Hello, welcome to the Dry Eye Group. My name is Rebecca Lee and I'm based at the Optometrist in Stockland, Taronga. So in this video, we're going to talk about dry eye syndrome, the different types, the different causes and symptoms. So you might have come to us because you're feeling that you might have dry eye. So let's start off with the symptoms. The symptoms include obviously dryness, so the feeling of lack of moisture on the front surface of the eye, grittiness or foreign body sensation, stinging, burning, watery eyes, or even persistent redness as well. So the two main types of dry eye disease are aqueous deficient dry eye and evaporative dry eye. So with the aqueous part of the tears, we usually think of that as the watery part of the tears, and that's always being produced by your lacrimal gland, which essentially sits up here near your eyebrow. Now, if there's any issues with the production of aqueous, then you're obviously not going to have enough moisture on the front surface of the eye, and that can lead to your dry eye symptoms. The other part, or the other type of dry eye, is evaporative dry eye, and that's mainly linked to the rapid evaporation of the tears off the front surface of the eye. So when we think of the tears again, there is the lipid component, and the lipid component is important because it prevents the rapid evaporation of tears off the front surface of the eye. The lipid component of the tears is always being produced by your meibomian glands, and they're glands that line the eyelid along the top and along the bottom. Over time, these glands can undergo changes so that the type and the amount of oil that flows onto the front surface of the eye is then altered, which then contributes also to dry eye disease or dry eye symptoms. Some people, or most people, will end up having a combination of these two types of dry eye, and in your dry eye assessment at the Dry Eye Group, we'll look at these two different types to pinpoint what's the cause of your symptoms. So in terms of the causes of dry eye, we usually think of these as intrinsic factors and extrinsic factors. So intrinsic factors means that these causes come from within the body, so whether that's your age or you're going through hormonal changes such as menopause, or even if you have general health conditions like diabetes, rheumatoid arthritis or Sjogren's. The extrinsic factors that we usually think about pertain to more your lifestyle and your environment. So this can include excessive computer use or overuse of your contact lenses, eye surgery, and even certain medications such as antihistamines and statins.